Reserved. Gentleman from Massachusetts.
Thank you, Mr. Speaker, and I want to thank the gentleman from Georgia, Mr. Woodall, for yielding me the customary 30 minutes. I ask unanimous consent to revise and extend my remarks, and I yield myself such time as I may consume.
Without objection, and the gentleman is recognized for as much time as he wishes to use.
Mr. Speaker, as we begin the second session of the 114th Congress, there is a long list of important issues that we could be talking about today. We could be talking about ways to support job creation, grow the economy, improve gun safety, strengthen national security, pass an immigration reform bill, and many other important priorities. Instead, we are talking about H.R. 3762, the latest attempt by House Republicans to defund Planned Parenthood and repeal the Affordable Care Act. As our economy continues to recover, we should be focused on expanding opportunity and helping more Americans get ahead. Instead, we are starting the new year by debating a bill that, if it ever became law, would put the health care of 22 million Americans in jeopardy and further restrict women's access to vital health care services. This is yet another blatant political move by Republicans to appeal to their to appease to their right-wing base. Republican leaders have said it themselves. Senate Republican Whip John Cornyn called this, and I quote, a political exercise, end quote, saying, I'm going to quote him again, we all recognize the president is not likely to sign this bill, so it's not ever going to become law, end quote. Then why on earth are we wasting the American people's time with this terrible bill? Now, we've heard that this month, Speaker Ryan, I'm going to quote again, will push to turn the House into a platform for ambitious Republican policy ideas, end quote. The 62nd vote to repeal or undermine the Affordable Care Act? The 11th vote to attack women's health? Really? That's the platform for ambitious Republican policy ideas? I think the American people should sue Republicans for malpractice. When Speaker Ryan took the gavel last fall, there was so much talk about a new chapter and fresh ideas. Instead, we're starting 2016 with more of the stale and politically motivated bills we've become accustomed to in this Republican-controlled Congress. We are constantly being told by Republicans that they have better ideas, that they have a better approach to health care. Really? Where is it? I would remind my Republican friends that in 2011, you passed a bill that actually tasked you to come up with an alternative to the Affordable Care Act. You came up with nothing. Nothing. Just last year, you passed another bill to come up with an alternative, and once again, you came up with nothing. So now here we are again, with a bill that repeals the Affordable Care Act and tasks Republicans to come up with an alternative. I'm curious, where is your alternative? Maybe it's in your notes. Is it hidden in some secret room in the Capitol? Maybe Donald Trump has it. Perhaps we should alert the Capitol Police, or better yet, maybe we call the FBI to locate the Republican plan on health care. I remind my friends, you're in charge. You run this place. You can bring whatever you want to this House floor. Maybe you should bring a bloodhound to the House floor to try to find your health care alternative plan. But governing is something that my friends on the Republican side are not very good at. They're very good about saying no to everything, but they can't say yes to anything. The Republican plan on health care is essentially a soundbite. Their prescription is take 2 tax breaks and call me in the morning. Now, not only have the Republicans done nothing to expand health care for the American people, and again, they're in charge, but they've actually consistently tried to undermine health access for millions of Americans. Take health care away from people in this country. And if Republicans had their way and actually repealed the Affordable Care Act, millions of young people under the age of 26 would be thrown off their parents' health plans. Being a woman would once again be a pre-existing condition. And much more of the progress made by the ACA would be rolled back. Mr. Speaker, contrary to what we often hear from Republicans, the Affordable Care Act is not killing the economy. I know facts get in the way of their arguments, but the fact is that America has seen a record 69 straight months of job growth, and all signs point to this historic growth continuing. In September 2012, when unemployment was at 8.1%, the Republican presidential nominee, Mitt Romney, claimed that the unemployment rate would stay at 8% if President Obama were reelected president. Well, President Obama was reelected president, and, Mitt Romney was wrong. What actually happened? The unemployment rate has steadily dropped each year and is now at a 7-year low of 5%, with employers adding about 210,000 jobs a month through last November as more Americans get back to work. Now, one of the frequent Republican claims that we've heard is that businesses would shift to part-time workers to avoid the Affordable Care Act's requirement to provide health care coverage to full-time employees. A new study released this week shows that the ACA resulted in little change in the number of hours worked, including the first 6 months of 2015 when the employer mandate first took effect for larger companies. As Politico noted, this study, and I quote, pokes a major hole in a beloved conservative talking point, that Obamacare will force employers to cut employees' hours, end quote. The truth is that researchers found no major changes in the probability of people working fewer hours in 2013, 2014, or 2015. Now, I've also heard Republicans claim that the ACA's expansion of Medicaid would decrease employment among low-income workers. But another study released this week showed no major changes in the way low-income workers fit into the labor market during the first 15 months of Medicaid expansion under ACA. Contrary to conservative talking points, the new coverage didn't push low-income adults to switch jobs, move from full-time to part-time work, or rush to find new jobs. In fact, the expansion of Medicaid under the Affordable Care Act has made a tremendous difference in increasing access to health care for America's most vulnerable families. Since October of 2013, more than 12.3 million Americans have been able to get covered thanks to the expansion of Medicaid. And as a result of marketplace coverage and Medicaid expansion, hospital uncompensated care costs were reduced by an estimated $7.4 billion in 2014, resulting in huge savings for consumers across this country. But that's the difference between us. Democrats believe health care is a right, and my Republican friends believe it is a privilege. To make matters worse, the bill before us today would also defund Planned Parenthood, which would put millions of low-income women, and men, I would add, at risk of losing access to critical health services. The fact is that 1 in 5 women has relied on Planned Parenthood Health Center for care in her lifetime, and Planned Parenthood serves 2.7 million patients each year. Additionally, Planned Parenthood clinics often serve as one of the few affordable care options available for many women and men. Cutting off access to the critical health services Planned Parenthood provides to some of our most vulnerable citizens is simply wrong. It is unconscionable. And 63% of voters, including 72% of independents, agree. But this whole effort to defund Planned Parenthood fits the Republican pattern of targeting poor people. And quite frankly, Mr. Speaker, it's outrageous. While our nation's community health centers do incredible work, the Republican claim that community health centers by themselves could suddenly pick up all the slack if Planned Parenthood is defunded is just not true. And my Republican friends know that. The idea that our community health centers could overnight suddenly step up and step in and cover millions of new patients is absurd. In fact, in 21% of the counties with the Planned Parenthood Health Center, Planned Parenthood is the only safety net family planning provider. Finally, let me just also voice my strong objection to the provision in this rule, which extends for another year the unrestricted authority for 4 House committees to conduct staff depositions at any time on any subject for any reason. Some committees have barely used this authority in the past year, and when they have, it has often been abused, with the threat of subpoena held over people's heads. The power to compel American citizens to provide testimony under oath should be rarely used and specifically authorized. Quite frankly, Mr. Speaker, I think the American people are tired of the partisan witch hunts that we have grown accustomed to under this Republican leadership in this House. We're starting the new year not by working in a bipartisan way to do the people's business. Unfortunately, we're starting the new year debating the same old bills that put politics ahead of people, and Mr. Speaker, that is truly sad. With that, I reserve the balance of my time.
The gentleman from Massachusetts reserves his time.